Tetanus. The very word can evoke fear and apprehension. It's a preventable disease, yet it conjures images of agonizing muscle spasms. It disrupts our body's control mechanisms, leading to potentially fatal consequences. Tetanus has plagued humanity for centuries. Why is tetanus so serious? Tetanus is not contagious like the common cold or the flu. It's caused by a bacterium called Clostridium tetani, which is commonly found in soil, dust, and manure. This bacterium thrives in anaerobic environments, places where there's little to no oxygen. When Clostridium tetani enters the body through a wound, often a seemingly insignificant cut or puncture, it multiplies and releases a potent neurotoxin called tetanospasmin. This toxin is the real enemy, wreaking havoc on our nervous system. Tetanospasmin disrupts the normal communication between nerves and muscles, leading to uncontrolled muscle contractions and spasms. Imagine your muscles involuntarily contracting, becoming so rigid that they feel like iron bars. This is the hallmark of tetanus, often earning it the nickname lockjaw due to the characteristic tightening of jaw muscles. What makes Clostridium tetani particularly resilient is its ability to form hardy spores. These spores are like protective armor, allowing the bacteria to survive in harsh environments for extended periods, even decades. When conditions become favorable, these spores germinate, releasing the active bacteria that can then cause infection. Tetanus symptoms typically appear anywhere from 3 to 21 days after infection, with an average incubation period of about 8 days. However, symptoms can manifest as early as 24 hours or as late as several months after exposure, depending on the amount of toxin present and the location of the wound. Early signs of tetanus often mimic less serious conditions, which can lead to delayed diagnosis and treatment. These early symptoms include muscle spasms and stiffness, particularly in the jaw, neck, and abdomen, difficulty swallowing, headache, restlessness and irritability, fever and sweating. As the toxin takes hold, the muscle spasms worsen, becoming more frequent and severe. The spasms can be excruciatingly painful, causing muscles to tear and even bones to fracture. In severe cases, the spasms can affect the muscles involved in breathing, leading to respiratory distress and potentially death. Other serious complications of tetanus include aspiration pneumonia, caused by inhaling food or fluids into the lungs due to difficulty swallowing, heart attack, pulmonary embolism, a blood clot in the lungs, and sepsis, a life-threatening infection of the bloodstream. Section 4. Pathways of infection. How tetanus spreads. Tetanus is not spread from person to person. It enters the body through wounds which act as portals for the bacteria to invade. Any break in the skin, no matter how small, can provide an entry point for Clostridium tetani spores. Common sources of tetanus infection include puncture wounds. These deep, narrow wounds, often caused by nails, splinters, or needles, create an ideal anaerobic environment for tetanus bacteria to thrive. Burns, damaged skin from burns, can become infected with tetanus spores. Animal bites, animals, particularly wild or farm animals, can carry tetanus bacteria in their saliva and feces. Soil and manure. Tetanus spores are abundant in soil and manure, making activities like gardening or working with livestock potential sources of infection. Drug injections, sharing needles, or using contaminated needles for injecting drugs can transmit tetanus. It's important to note that even seemingly insignificant wounds can pose a risk of tetanus, especially if they are deep, contaminated with dirt or feces, or involve a crush injury. Section 5. Combating the toxin, treatment and the importance of early intervention. Tetanus is a serious medical emergency that requires immediate treatment in a hospital setting. The goals of treatment are to neutralize the toxin, control muscle spasms, and provide supportive care. Treatment for tetanus typically involves antitoxin. An antitoxin, such as tetanus immune globulin (TIG), is given to neutralize the tetanospasmin toxin circulating in the bloodstream. Antibiotics like metronidazole or penicillin are used to kill the bacteria and prevent further toxin production. Wound care, thorough cleaning and debridement or removal of dead tissue of the wound are essential to prevent further bacterial growth. Muscle relaxants, medications like benzodiazepines can help control muscle spasms and prevent potentially life-threatening complications. Vaccinations. If vaccination status is uncertain or incomplete, a tetanus booster shot will be administered. Section 6. Shielding ourselves. Vaccination, the cornerstone of tetanus prevention. Vaccination is the most effective way to prevent tetanus. The tetanus vaccine is highly effective and safe, providing long-lasting protection against this potentially deadly disease. The tetanus vaccine is typically given as part of a combination vaccine called DTaP, which also protects against diphtheria and pertussis, or whooping cough. Children receive a series of 5 DTaP shots, typically at 2, 4, 6 and 15 to 18 months of age, and a booster dose at 4 to 6 years of age. After the initial childhood vaccination series, booster doses of the tetanus vaccine are recommended every 10 years throughout adulthood. In the event of a wound, your doctor may recommend a tetanus booster shot if it has been more than 5 years since your last dose, especially if the wound is deep, dirty, or caused by an animal bite.